Thanks, Dan. Utah ranks 7th lowest in the nation when it comes to mammography screenings, and experts say early detection is key to fighting the disease and increasing survival rates. Here to tell us more about why Utah's rates are so low is Intermountain Medical Center Breast Cancer Center Imaging Director Dr. Brett Parkinson. Friend of the show, happy to have you back here, but we're talking about something that seems like we talk about this often, but are our numbers improving?
Well, our numbers are improving, but only very slightly. A few years ago, we were second to last. Now we're 7th to last.
Okay, so a little bit better.
A little bit better, but we had done a little bit better last year, so we are slipping a little. I think part of it is due to the confusion of the task force recommendations.
Yeah.
However, if you really look at the American Cancer Society guidelines and the science behind it, that was recently published in the JAMA article, screening mammography beginning at age 40 every year saves the most lives. Even the task force admits that. But the problem is they say the harms of mammography, which basically is getting called back for additional imaging,
right,
may outweigh the benefits, which is actually having a life saved. So it doesn't really make sense because they say it saves the most lives at 40, yet they're saying start at 50. But we still recommend 40 every year.
Okay, because that is some of the confusion. You hear these different recommendations. Women don't know which ones they should listen to. So rule of thumb, go at 40, regularly screened at that time. What if you have that family history? Should you go in a little bit earlier or talk to your doctor?
Well, if you have a family history and you have the genetic mutation, you should be screened with MRI and mammography beginning at an earlier age. If you have a strong family history of breast cancer or ovarian cancer, which also confers additional risks, then you may want to screen earlier. I think women have to realize that there are barriers to mammography, and they should not be stopped by those barriers. They shouldn't be afraid of the pain. It's a little uncomfortable, but not painful. They shouldn't be afraid that it's going to cost them anything because insurers should pay for that, and recent legislation passed by Congress in a bipartisan way ensures that for the next 2 years, mammography will be paid for. They can get low-cost screening here in Utah or no-cost screening through the Utah Cancer Control Program.
How much better is the equipment now compared to, let's say, 5 or 10 years ago? How far has technology advanced in this field?
Just during my career, the last 25 years, technology has really improved leaps and bounds. We have gone to digital mammography, and now we have 3D mammography, which is tomosynthesis, which has improved the detection, and it's decreased the number of false positive examinations when women are called back. We also have breast ultrasound, and we have MRI. I think women need to know that the most recent study done by the American Cancer Society was backed up by good science. And they actually said in the beginning of the article that mammography will save the most lives beginning at 40. Women should also remember, the younger women, that 40% of the years of life lost to breast cancer occur in that 40 to 50-year-old age group.
Wow. Wow. So women here in Utah not getting those getting those mammograms done as often as they should. 40 years old.
Right.
It's not as painful as you might think. Take the time to do it. If you have insurance, they'll likely cover it. No reason not to go, and make sure you'll still be there for your family. Dr. Parkinson, thanks for joining us.
Thank you very much.